I had a patient come in this week who was coming to see me about heart arrhythmia, some problem that their heart skips a beat. But when she walked in, she was all bunched over and kind of, she's young, she's 43 years old, 44 years old. But she was all hunched over. And my staff said, I don't get it on the schedule. It says cardiac arrhythmia. And she's going to have her hormones and all that other stuff evaluated. And she could hardly walk coming in. Well, she'd driven in from far out of state, way out on the East Coast. And we're in Texas, so she has a long drive. And she really jacked her back up pretty badly. And I forgot how important it is to have that set of skills in a holistic practice. You look at body, soul, and spirit. You look at structure, the back and the neck and all that, how it relates to the rest of the functions of the body. Because if the back is not working well, the nerves that supply the heart will not be working at their best. That can create more problems with cardiac arrhythmia. So anyway, back pain for me, that's a wheelhouse for me. I mean, I can just nail it. I'm an osteopath. I do that all the time. And I just, for some reason, I had forgotten how much importance there is in treating a patient, in knowing the structural care. So I want to just hit you real quick with what I think about when I see back pain. This patient, she was bent over, kind of this, at her waist, and she couldn't walk. She was hinged at her low back. That's called the sacroiliac. Sacrum's the tailbone. Iliac is at your hip crest. Her sacroiliac joint was affected. How did I know that? Because when she bent over to pick something up, that's when she started to experience the pain. And she's had it multiple times. So the mechanism of injury. She didn't hear a pop. And it didn't get worse when she strained. So disc injury is less likely. When I pushed on her back, I could find the spot. And it was right there in her sacroiliac joint, her little joint there in her low back. And I knew, because she didn't have leg pain, that she wasn't having a disc problem and that there was a nerve that was being pinched. All those things, they're real simple. So for you, if you have back pain, it's just achy and chronic and low grade, yeah, get some acupuncture. It's a great idea. Stretch, yoga, Pilates, all those things are great. If you need acupuncture, acupuncture can make a huge difference in chronic back pain. For me, with this patient, I did an injection. I did some injection therapy into the sacroiliac joint using a very natural numbing medicine and a little bit of medicine to reduce inflammation. And she went from walking into the office hunched over, couldn't walk, and 5 minutes after her treatment, she was up and getting around and doing all her stuff. And then I could address all her other stuff, her hormonal levels, her cardiac arrhythmia, very effectively. One, she was out of pain. And two, I handled her from the perspective of body, soul, and spirit, structure and function. And she got great results. So if you have back pain, get with your doc. If you can get to an osteopath who's skilled in manipulative medicine and structural medicine, that might be your best bet of all. But back pain is not something you have to live with. It can be addressed. And if you have a doctor who knows what he's doing with that kind of stuff, you can get rid of your back pain. Always get with your doc. Don't just take medicine or something over the counter without knowing what's going on, because we're better together.